If you've made the decision to become a smoker, let's discuss how you're going to light up, how you're going to inhale, and what's going to happen inside your body. When done correctly, you'll feel relaxed and stimulated by the pleasure chemicals in the smoke, and you'll know you've done it correctly. So take a cigarette now and place it between your lips. You'll need a lighter next. Bring the flame of the lighter just to the tip of your cigarette and suck gently on the filter. Suck gently until the cigarette catches, and you see a little smoke coming from the tip and/or from your lips. Well done. Now the next step is learning how to inhale the smoke. We need to inhale because the pleasure chemicals in smoke cannot be absorbed from our mouth. We need to get the smoke to somewhere our body can absorb it and make use of it. And that means getting the smoke down into our lungs. This is a two-step process, so pay careful attention. First, we want to suck on the filter again gently to draw some smoke into our mouth. Then you part your lips slightly. Try not to let too much smoke escape. Take a slow, steady inward breath and let the air moving in carry the smoke with it down into your chest. And then slowly exhale through your mouth, or your mouth and nose together. Just breathe out gently. You should be able to see the smoke as you exhale. Try again. Suck the smoke into your mouth. Part your lips and gently take a deep breath to draw the smoke inside. And gently exhale, watching the smoke leave on your breath. We want the smoke to get to where it can be absorbed. We want to send it down to those little air sacs at the bottom of your lungs so it can enter your bloodstream and be absorbed. And from here, the nicotine and other pleasure chemicals are carried in your blood to your brain. Your brain has receptors which unlock when exposed to nicotine. Everyone has these receptors from the day they are born. Nicotine unlocks them and releases a flood of nature's pleasure chemical called dopamine. This gives us the feeling of pleasure, euphoria, relaxation, and stimulation. Dopamine is our body's reward chemical, which helps us by giving us a feeling of pleasure when we do something we enjoy or that makes us feel good. You should feel the first effects of this extra dopamine within about 10 seconds of your first inhale. And you can follow that up with another small inhale now. Take small inhales. Go slowly and try to get used to the sensations of the smoke going down, the taste, and the rush in your head. It's absolutely normal to cough a little at first or to feel a little dizzy. Just keep practicing and sit down if you need to until you get used to it. It's probably wise to practice a couple of times a day until you build a little bit of tolerance. When starting out, most smokers seem to average 3 to 5 cigarettes per day. And then after 2 weeks or so, settle into a routine of somewhere between 5 and 10 cigarettes per day. How much you want to smoke really depends on your daily routine, your lifestyle, and where you're able to smoke. Try to stay consistent for the first 2 weeks, and after that, you'll find your own rhythm with it and what feels right for you. Remember, the smoke goes in your mouth first, then take a slow, deep inward breath, followed by a slow exhale from your mouth or nose. You'll grow in confidence as you practice, and you'll get better at getting all the smoke in on your inhale. And get more satisfaction when you see long, smooth exhales of smoke coming from your mouth, which shows you that you got the smoke where it needed to go. Like anything that feels intensely pleasurable, smoking is addictive. So you need to consider carefully how addicted you want to be, and make a decision that's right for you. Whenever you feel the urge to have your next cigarette, you'll have a choice of whether you want to give in or not. And that's a choice only you should make. The decision to smoke is a very personal one, and it's entirely yours to make now. I, for one, hope you enjoy every inhale. Good luck.